Hey everyone, welcome back to our Impact Your Life channel and episode 12 in our pregnancy and postpartum series. My name is Christie Amundson. I am 31 weeks pregnant this week and I'm also a physical therapist. And today we are going to be going over some different braces or supports that you can use during pregnancy or during the postpartum period that can really help support and stabilize your body through your pregnancy and your postpartum period. Some of the braces that we're going to talk about are specifically maternity braces, so they are made for use during pregnancy. Some are not specific to maternity, and then some you can kind of use for both. So they could be a maternity brace, but you can kind of use for both periods. And I will kind of highlight that as we go through here. Generally speaking, when you're using supports, you want to try to use them as little as possible, but as much as you need to. So I know that seems kind of oxymoronic, but usually you want to use them when you're doing things that are the most aggravating to you. So if you have a job that you have a lot of pain, you're up walking around, then maybe you would wear the brace during your work day. And when you get home at night, take it off when you're able to kind of sit down and rest a little bit more. Generally speaking, you want to try not to wear them at night for a couple reasons. Number one, your skin and body kind of needs to breathe and get a break from the brace. And also you do want your muscles to not forget how to stabilize those areas. So although they're maybe moving a little bit too much during pregnancy or the postpartum period, generally speaking, your muscles are trying to stabilize, whereas if you wear a support or a brace, it allows your muscles to kind of take a back seat or a vacation during the time the brace is on, which in the long term, if you're using it for a very long time, then that can actually set you backwards. So it is certainly okay to use them during your pregnancy or the latter half of your pregnancy and the very beginning part of your postpartum period, but beyond 6 to 8 weeks post delivery, you're gonna want to try to wean from the brace. So we're gonna talk about 5 different options for braces today that we carry at our clinic and recommend based upon the feedback that we've gotten from our patients that were pregnant or in the postpartum period. We are not necessarily endorsing the braces that I'm showing you. We have just found the best success rate with them. There are lots of different options out there. I am going to link the specific ones that I'm going to show you today in the comment box below for your convenience. But if you wanted to explore your options, you certainly can do so. We're going to highlight kind of what each brace or support is commonly used for, pros and cons, and then I'll demonstrate kind of how to put it on and what it kind of show you what it looks like and try to explain how it feels. Okay, so the first support that we're going to talk about is called the V2 supporter. This brace or support is not necessarily maternity specific. It can be used for pregnancy, it can be used for postpartum, and then it also can be used for other uses like prolapse of your bladder or uterus. So it is not necessarily pregnancy specific. In pregnancy, however, this is a great support if you are having issues where you have a ton of kind of pain and pressure down into your pelvic floor. If you either have prolapse tissue or feel like things are prolapsing, meaning starting to fall down or come out of your vagina. If you have a lot of swelling in your pubic area or in your like genital region, perineal region, which is basically anything between your pubic bone and your sit bones back here. So all this middle region is called your perineal region. So if you feel like you're getting swollen down there, and then also if you have pubic bone pain, this can be really helpful too. We call this the female jock strap because that's kind of what it looks like. Oh, and then the sizing for this one is, it has a non-pregnant pant size, a hip measurement, and then a current weight. And sometimes, depending on where you are in the pregnancy, you could be between sizes. And I actually am between sizes on this, and I tried on both, and it is definitely better to size smaller. The bigger one tended, at least in my experience, it tended to not give me enough support. So although the smaller one feels like it's maybe too tight. I did try on the bigger one, and it was, it didn't give me enough pressure. So it looks like this, kind of like I said, a female jock strap, almost like underwear. So the front has this little lacy thing. The back has the tag. You would put it on just like underwear. You're gonna wanna put it on over like boxer briefs or something so that it doesn't chafe your skin. And then usually it has these Velcro straps in the back. So what I do usually is I loosen them when I first put it on. So it's just easier to get on. You don't necessarily have to do that, but. So you would put it on just like underwear, and then you're gonna pull it up. And I tried to wear something that made this a little easier today. So it looks like underwear. You would not wear it over your clothes like this. I'm just doing this for you guys. And then in the back, depending on how much pressure or support you want, you will unvelcro these, and you're gonna wanna pull them. So you wanna stand with your weight kind of evenly distributed, and you pull, and then you can Velcro them down like that. Obviously, the tighter I pull them, the more it's gonna actually pull this through and kind of lift and support through your crotch region, basically. So like I said, this is great for anyone that feels like, oh my gosh, everything is falling out of me, including the baby. That kind of feeling of pressure and pain in your pelvic floor, or also pubic pain. So that's the V2 supporter. So our next brace is an SI belt. Now you can have a maternity version of an SI belt and a regular version of an SI belt. The one that I have today is actually a regular SI belt. It is not maternity. And I will kind of tell you the pros and cons of this, but we have found that this particular SI belt brand called Sorolla, it goes by, so this is a non-maternity product, so it's gonna go by the width of your hips. So the sizing is there, and obviously it would apply to, what your hips width is when you're actually ordering it. And this SI belt, one of the main reasons we like this one a lot, so it comes like this, and it has 2 additional Velcro straps, and the straps on it are stretchy, so these stretch. However, the belt itself does not stretch. So it's almost like the consistency of like a towel. So it's pretty firm, and that's actually why we like it better. There are a lot of different SI belts, and a lot of them are kind of this material, stretchy material all the way around the belt. The way that an SI belt works is it's really meant to compress your pelvis and the joints in your pelvis, so it helps with pubic bone pain, and it can help with SI pain. Your SI joints are the low joints where your pelvis and your tailbone connect. So they're kind of like where your dimples are, right in your buttock region here. So if your pain is pretty low in the back, it's probably your SIs, like down by your pelvis here. If it's more up here, that's more a different brace that you'll see in a second. So with this, I like the non-maternity versions of this better, because most of the maternity versions they end up having a pad in the front, and they usually either the entire belt is more stretchy, or they'll have a section in the front that is more stretchy to allow for your belly. So depending on how this feels to you, you may need that, but it does a little bit compromise what the belt's actually trying to do by making it stretchy. So that's just something to consider. A good way to know if an SI belt is gonna work well for you is if you have someone, a friend, your partner, your spouse, that can help, that if you just stand there and if they take their hands and compress laterally, like in toward your pubic bone, and they push on your pelvis in, and that relieves your pain either in your pubic area or in your back, then that basically is what an SI belt does. So that may help you. The other thing you could try is if you just have like one of the belts, like a pants belt. You could try just putting that around. You probably want something that's not super skinny, but something a little wider. But if you could try putting it around and just seeing if that compression actually gives you a little bit of relief. And if it does, then this belt might be good for you. So the biggest thing with an SI belt, usually they have a label either on the back or on the front to tell you which side is up. So here's the label on this one. And then they usually have some kind of either a seam or an emblem in the back to tell you where the center is. So this has a seam in the back. So I'm gonna just center it on my tailbone, and I wanna put it very low. So in this case, what I usually tell people is you can wear this over your clothes, but you usually would wanna like wear a long shirt over it or something. So again, I'm gonna find that seam, put it in the center, and I'm gonna kind of put it on my tailbone. So I want the belt to go, if you feel on the side of your hip here, your pelvis bone comes up and the top of your pelvis bone is here. So it needs to be below the very top of your pelvis bone. But if I kick my leg out to the side, the belt shouldn't be limiting me to be able to kick out to the side. So if I poke myself, there's a bone that starts, obviously this is my side, and then I'll hit a bone. So I want to be below that bone, but then I want to be, if I keep going down, I'll hit another bone, which is actually the side of my hip bone. I want to be above that bone. So kind of the belt should land right in between those two. And then you're going to Velcro it, and you want to put it relatively tight, but the first part doesn't have to be as tight. And then you're going to take the Velcro straps and you're going to pull out and then wrap around. And you try, if you can, to do them at the same time if you can. If you're doing it yourself, or if you're having help, somebody can stand behind you and do it rather than doing them one and then the other, because sometimes one of your arms could be stronger than the other, or you get like a kind of a twist. So want to go out and around. And again, that's the piece that really helps to compress. And so I actually am carrying pretty low in this pregnancy, and this still doesn't bother me because of how low the belt goes. So again, I don't need the maternity style of the belt, and that way it becomes a little more versatile as well, because I can use it beyond my pregnancy into the postpartum period, or even beyond that if I happen to have some SI issues down the road. Years from now, I can still pull out the belt and potentially use it to help me out. So this is an SI belt, and we'll move on. So the next choice is a lumbosacral support. So this support is going to be more for back pain, like we talked about earlier. Any pain that is more above, like your hips here, so not your SIs, but more above that through your back. So we have a couple braces that will address that. This is called the Physician's Choice Maternity Mate Support. I like this for back pain, and then I also, another kind of thing that I don't think they really advertise on this one, but that we found with quite a few of my pregnancy clients has been that it has been really helpful for, actually it can help if you're carrying really high or have a lot of pain in your ribs, then it can help. It has a strap that kind of can give a little pressure down, so it can help that. Also, sometimes that can be helpful for reflux as well. So it's kind of a side benefit that I don't really think is advertised on there, but we found that it actually does, it seems really helpful for that. So it comes with 3 pieces. So this is the main piece. It's like a V shape, and then it comes with a front piece, so it's totally adjustable. This is a maternity product, but I don't see why you couldn't use this outside of maternity. I'm going to show you a different back brace that is used more for postpartum that really isn't a maternity product. So if you are just looking for something that is only postpartum, or you're not pregnant at the time, then I would maybe not go this route. But if you want something, I would think that this could be used during the postpartum period as well. And then it comes with this top strap that is optional to use. So if you look at this, makes like a V shape. There's little Velcro pieces at the top. So this is always this is the top, and you're going to center it on your back and Oops, actually I lied. Sorry. This piece goes on first. You're gonna make the V shape right under your belly, and this is the part that's adjustable. So you can make this as tight or as loose as you want. But again, depending on how far along in your pregnancy. And then you're gonna put the bigger piece on. Again, the V shape goes like this, the Velcro goes on the outside. And you're going to try to center that V kind of right in the center of your back. If you have a mirror, sometimes that can be helpful. And then you're gonna pull around and Velcro onto here. So again, you can adjust how tight this first piece is, but really the compression is gonna come from this big piece here. And what this big piece does is it kind of helps to lift and support your back. So the pressure isn't falling forward so much and pulling on your back. So it helps to kind of, I know you'll see a lot of people during pregnancy kind of clasp their hands underneath their baby and kind of be lifting up a little bit. It helps take the pressure off of your back. That's basically what this brace does. So you could wear it just like this, or you could wear it with this top strap. And this is the strap that some people, it just drives them nuts, but this is the piece of it that if you're carrying really high or have really bad reflux, it can kind of help with that. You're going to put it on the Velcros, the little Velcro straps, but then it goes around this way. And again, you can kind of gauge how tight that is, but some people it drives them nuts because it kind of does just squish. It feels like it just squishes your stomach, but it can really relieve some of that if you find yourself throughout the day kind of pushing down a little bit because you have the baby is up underneath your ribs a little bit, or you're carrying really high, or you're having bad reflux. Sometimes just pressure down like this helps, which is what this strap can provide. So again, optional, but I've found that I actually have really liked it, especially in my previous pregnancies where I've carried higher. I've really liked kind of that downward pressure. And again, you can kind of adjust it a little bit too, to decide how much or little you want to have it pushed down. All right, so we'll move on to another brace that can help with back pain as well. The next brace is also really good for low back pain. Again, pain that is a little bit higher above your pelvis, all the way through here. It also can help if you have kind of pain that transitions up into your upper back as well. It's called the Best Cradle. And this sizing, it looks like does, it has both your pant size prior to pregnancy and your current weight. So, I'll show you that. All right, so this one, the benefit of this one is it really helps to redistribute the pressure, as opposed to the last one that I showed you is really just kind of a band around here with the extra potential band across here. But this brace actually helps to redistribute it kind of all over your kind of torso. So it can actually sometimes be more helpful in terms of alleviating the pain or redistributing it. So this brace is for maternity, and although it is adjustable, it has kind of like these bra clasps on the strap that may not be as good after pregnancy. I guess I've never really tried this on after pregnancy, but if you shrink down to the size where you would need it smaller than the smallest rung, then it doesn't really apply. So it's better as a maternity brace. So when you open this up, it looks like a sea of straps. So the best way to do this is to look at the tag. So the tag would go in the back, and then it's like you put it on like a shirt. So if you kind of shake it out, you'll see that it sort of has straps like this. And you'll notice there's an X. And a lot of times the instinct for everyone is to put the X in the back, but the X actually does go in the front. So I'm going to put this on. So the X will go between your breasts, and then this strap goes all the way underneath, and you're going to clasp it. And again, it is adjustable. So depending on what size you get, if you size up or size down, if you're like kind of between sizes, it does allow you some flexibility. So the nice part about this one is it is adjustable up here, that you can sort of like a bra strap. So you can make this looser or tighter depending on how much weight you want distributed up into your kind of shoulders. So if you're someone who tends to have too much tension and pain up here in general, you may not want it to be very tight up here, and you may want to loosen it more. So this can function very similarly to the last one I showed you. If I loosen these quite a lot, then most of the weight distribution is still kind of acting as that kind of just lifting up. But it also has the option to kind of experiment a little bit with how tight or how loose these straps are in the back to lift and redistribute more or less depending on how it's feeling. So again, like I'm on, it's like the middle rung right now, and I'm 31 weeks, so I have a little bit of room to grow, but then in the postpartum period, I may be able to get away with using it on the smaller rung, but it might not. It might be still too big at that point. So that is the best cradle. I would say of all of the two braces that I showed you, this one and the last one, more of our pregnant patients have preferred this one. Again, we have the luxury for them to be able to try them on and see which one they like better in the clinic here. But typically, this has been more popular, if that's worth anything. Okay, and I want to show you one more brace that's more used for postpartum. So it is not a maternity brace. So I will show you it, although I don't know that it'll fit me right now, but we'll try. And that brace is more for after you've had either your C-section or your vaginal birth to help give you some stability. So we'll do that next. So the last brace we're going to talk about is more for the postpartum period. And this particular brace that I have here is not a maternity brace. I'm going to try to put it on and show you kind of what it would look like, sort of, but it will look much different on someone who isn't pregnant. But generally, after you have your baby, your everything in your abdomen feels kind of like it just is jelly, basically. And your abs are used to being way overstretched, so they're really just trying to adapt and trying to get back to not only at like a more normal length, but they're trying to function at that normal length again. They're not so good at it at first, so something that comes around and supports your abdomen and supports your abs and your back for that matter can be really helpful. It can be helpful both from a vaginal birth perspective as well as a C-section. So you can get this brace in particular is actually, I think it's a lumbosacral brace. The sizing on this one is not on the box, so I'll link it below, and you can. I'm sure it's on the website. But generally speaking, this is a lumbosacral brace. Like I said, it's what's called a 4-panel, which basically just means it has 4 Velcro straps, 2 on each side. If you're looking at one that says it's a 2-panel, that just means it has 2 Velcro straps, 1 for each side. Sometimes you can just look at, if you want to look at just abdominal binders, that would be just like basically this main strap going across around your abdomen. Again, it's just you're looking for a little bit of compression, stability, support as your abdominals kind of get back to learning how to work at a more normal length. This would be something that you would not want to wear really long term. You would want to wear it for the first several weeks postpartum. And you can ask your provider, depending on your particular situation and how traumatic your birth was, whether or not wearing it for 2 weeks postpartum versus all the way up to the 6-week mark. Sometimes, depending on your certain circumstances, that can make the difference. But I would not recommend using it much beyond the 6-week mark unless your medical provider recommended that. Again, it does kind of allow your abdominals to take sort of a vacation and not work as hard. And obviously we want to support them, but we also want them to relearn how to activate appropriately to stabilize. So again, this is not a maternity one, but you would wrap it around your belly to support. And then you would take these Velcro pieces. And again, you're trying to, kind of similar to the SI belt, you're gonna pull around as much or as little support as feels good to you. And these Velcro pieces sort of act like your abdominal, you have abdominal oblique muscles that kind of wrap around the sides here. And they kind of function, the Velcro straps just assist those muscles, as well as your transverse abdominis, which is the muscle that acts almost like an abdominal brace all the way around. It's a very deep abdominal muscle that really helps stabilize your spine and your core. So that would be what if you just had one single strap that goes around is an abdominal binder, that would be what that is really kind of helping or assisting the most. But this can be really, really helpful postpartum, especially in the very early weeks when your body feels really unstable and it's just kind of relearning how to not be really distended anymore. All right, so those were 5 different options for different maternity and non-maternity supports that you can use during your pregnancy or postpartum period. I hope this was helpful for you. If you found anything helpful in this video, if you could like it and hit the bell icon for some notifications and subscribe to the channel, that would be great. And we will see you guys next week. Take care.